Dr. Jean Ann Conry.
Wonderful. What inspired you to get involved with this project and regarding prenatal supplements?
This has been a long time coming. My first interest was when the California legislature contacted me and said, "What do you think about lead in lipstick?" And I realized, oh darn, I didn't know there was lead in lipstick. Lead's bad, lipstick's good. We're in a quandary.
And what studies were done regarding toxins in prenatal supplements?
The studies have been limited, but probably the most important one came out a couple of years ago, a research study out of Canada that showed all of the vitamins tested, they were from North America, had toxic chemicals in them. Lead, mercury, arsenic, pesticides. And that was something that we did not expect. We always assume that a vitamin that we're prescribing for our patients is safe. And here we have a study that says, no, they're not safe. You're making assumptions that aren't valid. The assumption being, if it's a product, it must be fine.
Sorry, I crashed you. You could say the assumption being one.
The assumption being is that if it's a product on the market, it must be safe. And that's not the truth.
Well, I would assume that those toxins could cause all sorts of problems in infancy.
They certainly do. We definitely have seen increased risks of neurodevelopmental disorders, whether that be ADHD or autism. We've certainly seen changes in birth defects and reproductive health in moms that are all linked to toxic chemicals in the environment.
So tell me a bit about the genesis behind how this new product was created and your involvement in bringing it to fruition.
This is one of those times when you can realize good things come out of bad times. During COVID, we knew that we wanted to pull together a group of scientists from around the globe. We proposed that the year before. COVID hit and we couldn't meet. So we met virtually over a series of meetings and discussed what chemicals we thought there was enough evidence that we should say they should not be allowed in any personal care product, in a vitamin, in the water we drink, in the air we breathe. Once we came up with that list, we said the first thing we need to do is look at our vitamins.
Yes, what does P2i stand for? Could you incorporate my question into your answer?
P2i stands for preconception to infancy. If you think about our goal, it's a healthy child. And how do we get to a healthy child? Well, healthy pregnancy care. But we know that it starts before pregnancy, even before conception. A woman's lifestyle choices, a woman's vitamins and supplements, and all of those combine to improve a woman's health. And when her health is good and her well-being is good, we increase the likelihood we'll have a healthy child.
Beautiful. Eric mentioned to me that this the study revealed that there was a necessity for certification of prenatals and a standard of care. He mentioned this standard of care phrase to me. Could you explain a little bit about what that was?
The International Federation of Gynecology and Obstetrics pulled together a consensus statement. We took the leading scientists from around the world who are interested in women's health and know a lot about environmental toxics. And we asked them to come up with a list of chemicals that should not be in any product we use. But you can come up with that list. If you can't certify and make sure that those are not present, you haven't accomplished anything. You can read a label, and just the fact that something's not mentioned on the label doesn't mean it's not in a product. P2i says that this product has been tested and all of the chemicals that we've said should not be present are not. So it's a certification that says this company, this product, this vitamin, P2i, says that we don't have any of those toxic chemicals in this product.
Great.
FIGO is the International Federation of Gynecology and Obstetrics. We represent over 135 nations from around the globe, the OBGYN societies in each of those countries. We put together the leading experts, and from that group of leading experts, we said what chemicals should never be present. And then we share that information with all of our member societies. So it is a recommendation from over 135 societies that we need to protect women, we need to protect children, and we can do that by making sure that these toxic chemicals are not present in any product that a woman might use.
Wonderful. How are you going to create awareness and get this into the hands of doctors? And if you can incorporate my question into your answer.
One of the greatest tricks is getting clinicians, whether we're talking about physicians, midwives, physician's assistants, nurse practitioners, to change our habits. And that habit comes from years of doing something a certain way. The wonderful aspect of P2i is that every product that meets our standard will have a symbol P2i on it. So all we need to tell our clinicians is look for P2i on the label. You can assure your patient and you can assure yourself that they have been tested and meet the very highest standard, and that the chemicals that we're worried about, the toxic chemicals we're concerned about, are not present there.
Beautiful. And then last but not least, how did you come to meet Nate and get involved with him in this project?
Dr. Nate DeNicola and I have been colleagues for over a decade. When I was president of ACOG, Dr. DeNicola reached out to me and said he was very interested in the environment and environmental issues, and what role could we find for him. And it was absolutely perfect timing, because I had 3 goals as ACOG president and then again as FIGO president. My first goal was maternal safety, to make sure that labor and delivery was a safe environment for women and for delivering. My second goal was well woman healthcare, to make sure that women and their health were a major priority in the United States and now around the globe. My third priority was the environment, how to increase awareness about the impact of environment on our health. Dr. DeNicola became our liaison between ACOG and the American Academy of Pediatrics, focusing on the links between the two. And then when I became FIGO president, I had the same good fortune to have him in that position too.
Great. Okay.
It's not enough just to have a clinician or a healthcare system involved in this. To me, the most important step is that this is about empowering women. Women make the decisions for their health, for their family's health, and really, if you look at it, they're deciding on our futures. We must be able to empower women to make the decisions for their health and their well-being. And it all starts with a healthy diet, healthy nutrition, and certainly the right supplements.
So, the question is, what inspired you to look into what was going on in the certification of prenatals and what was in the prenatals, and to do this study? Tell me a little bit about the genesis of this project.
Sure. Well, I came across a quote from Richard Branson, who was the CEO of Virgin Atlantic and Virgin Company, and he said he only takes on a project out of sheer frustration with the status quo. And I've kind of used that as a barometer for taking on a new project. So when I realized that there is this very essential daily supplement we recommend for pregnancy, and that every woman in the entire world takes this pretty much every single day during their pregnancy, it's really the most used thing in prenatal care, and that it gets such little scrutiny, it has such little vetting, and there could be not only not the good vitamins we want from there, the folic acid, but there could also be something that's hazardous. To me, this was the obvious area to devote some attention. There was some frustration with the status quo.
So how did you go about looking into how you could create or rectify this?
Well, you need to look at the real root cause, right? Because there are a lot of prenatal vitamins out there that claim to be tested for some version of toxic chemicals. But when you look at the whole kind of umbrella, or the whole universe of toxic elements that could be in anything we consume, anything we eat or drink nowadays, it really is much wider than just a few heavy metals or just a few chemicals. There are comprehensive lists of these hormone-disrupting chemicals. There are things like microbes, so infectious possibilities. So if you're really going to do it, you have to do it right, which means going to the source materials, starting at the very beginning, and making what you screen for as comprehensive as possible.
And what is P2i and why should people take it?
So P2i is a program from our Forum Institute, and it stands for Pregnancy to Infancy. It is an initiative that will ensure that the next generation is as healthy as possible. So in this case, looking at prenatal vitamins, the P2i label is an assurance that the product you're about to consume, the vitamin or whatever it is, has been tested as thoroughly as possibly can be done to make sure there's no heavy metals, there's no toxic chemicals, there's no infectious microbes that are in what you're about to consume for yourself during your pregnancy or perhaps to give to your children.
And I understand that rather significantly you have the endorsement of some governing bodies in this field. If you could tell me a little about that.
Correct, yeah. So at the most recent World Congress in Paris, the International Federation of Gynecology and Obstetrics, FIGO is the abbreviation, the leading voice for international women's health, published a statement saying that there are more than meets the eye when it comes to prenatal vitamins, that there are a number of chemicals and toxic elements and heavy metals not being tested currently, and that they should be, that the pregnant women should be protected from these things in anything other than the very scarce amounts. So we know that there are perhaps, no way to ensure there's zero of certain things, but there should be what's called de minimis. It should be the lowest, acceptable amount so that we're not adding toxicity to, some of the earliest stages of human development in early pregnancy and even in preconception.
And I understand you got endorsements from FIGO and ACOG.
Well, so FIGO has published this statement saying that this is what should be done. The P2i label effectively is taking that medical advice and making it real. It's applying it to the manufacturing process, it's applying it to the original source material, and then it's applying it to the finished product. So in kind of every step along the way, it's doing rigorous testing. And for the American College of OBGYN, they have recommended, one, that people take prenatal supplements to get the folic acid, and also have called attention to the dangers of toxic chemicals, particularly when it comes to prenatal care and preconception care.
What are your aims and objectives? I assume you want to create awareness about this and getting it into the hands of doctors.
Yes, we want, I'd say it's twofold. Number one,
so if you could incorporate my question, I'd say our aims and objectives are.
So our aims and objectives are twofold. First, we want to reach the clinicians. We want them to know about this topic. Most clinicians who are involved in women's health know something about the lack of testing on supplements. They do undergo, by the way, some testing, just not nearly efficient or not nearly sufficient for pregnancy. So we want clinicians to know where the risk is, that the supplements may not have all the listed ingredients, specifically folic acid, and they might have other toxic chemicals. For example, they might have uranium in them. Tests have shown that. After that, because the clinicians will be the ones educating patients, we want the patients to know what they're getting into. We want them to know that they have choices in what they choose as this essential supplement for their pregnancy and their preconception, and even for what they give to their children later on in supplements. So we want them to know that there is an option out there that has been tested, not to be hyperbolic here, but has been tested more than any prenatal supplement has ever been tested before. This is the first time that something this comprehensive has been done with the backing of the international experts, as well as the backing of the manufacturing process.
Great. Last but not least, Eric mentioned that they're working on other supplements and testing kits. That doesn't involve you either, though, right? The heavy metals testing kit, the detox supplements, probiotic supplements. That's not your.
Well, I mean, those all apply to what we're doing here. I mean, but probiotics, no, I don't think we talked about that. I think those are separate things.
Okay. Well, last question then. How did you come to be collaborating with Dr. Conry on this? What was it like meeting her, and what does she bring to the pedigree that she brings?
So Dr. Conry is the original champion of women's health and the environment. She has been a steward and a leader on this for many years. She and I met when I was in fellowship at the University of Pennsylvania, and I had attended a lecture by Mark Tursek. He then was the CEO of the Nature Conservancy. His prior job was as an executive at a Fortune 500 company. Now that's a very unusual career switch, to go from a Fortune 500 executive to being the leader of a environmental kind of activist group. Those often are at odds, if not, not a natural connection. But Mark Tursek's lecture was that his best advice to companies was they have to deal in reality, and that meant protecting the natural resources. And that led him into a career in environmental stewardship and eco-protection. When I attended that lecture, afterwards I went and talked to Mark, and I said, Mark, I really loved your lecture. What are you doing with the healthcare community? What are you doing with doctors and nurses? And he said, that's a good idea. Someone should be doing that. Meaning he had no knowledge of that work. He was not engaged with healthcare. So I thought this was an opportunity that, again, would pass that Richard Branson test, that nobody else was doing it, and it was the reality we had to deal with. So I reached out to our leadership in the environmental space and our leadership in the medical communities. Jeannie Connors was one of them. Sent an email, arranged some phone calls, and very short after, there was a liaison role between the OBGYN societies and the pediatric societies that they asked me to fill. Because the pediatricians were already coming to the OBGYN saying, by the time the kid gets to us, sometimes it's too late, which is really incredible when you think about, a 2-year-old being too late in their healthcare journey. So they were asking the OB doctors to be more vigilant in intervening during pregnancy, but even more so than that in preconception. So Dr. Conry has enabled this kind of one relationship to blossom into multifold relationships now, where we have not only the OB and pediatricians working together, but all the different House of Medicine working together, and doctors working with toxicologists, with environmental health experts, with patient advocacy groups. So it's really a vision of leadership that it connects all the dots, that takes that core patient-doctor relationship and expands it to really a global reach.